When I served in the past in Kittitas County, one of the things that came up was that Vantage, that big development that's going in at Vantage, and this one, neither one at the time had the county commissioners made provisions about fire district funding and EMT funding and all the other stuff that should have been in there, the 911 service, etc. Has that been dealt with, or is that still out there in the ether that we don't know whether we're going to get any money from them or not?
Can somebody repeat the question?
Yes.
So sorry.
Sure.
Is there a second microphone?
The question was whether or not the developments will assist in paying for the existing services. And the one that was mentioned is the housing development down in Fire District 4, which is down in Vantage, and then some of these others. And the answer to the question is Vantage is within KBFR's response area for EMS, and we have received nothing relative to that, and we won't receive any tax money because it's in another fire district. So obviously, Fire District 4 will realize an increase, but I just looked at their total taxes on a website the other day. To put this into perspective for you, the totality of Fire District 4, they get about $40,000 a year to run their fire department. So again, because they are small and they have been resistant to any sort of consolidation, they run their district sort of on a shoestring. Now they get a little bit of additional money from the wind farms that are between the old road, the old Vantage Highway, and the freeway. But that's going to probably double their available taxes. But unless they do a lid lift, they'll get the new construction, but over time, they continue to backslide as far as their levy rate. And that's the issue. As far as, so Fire District 2, which is KBFR, has pretty routinely gone back out to the public and explained the need to keep the tax rate at $1.50. And District 7 has been able to do that. I know in the last year, Fire District 1 and Fire District 6 were successful in getting their levy rates up. Unfortunately, our Roslyn Fire Department sadly failed by, I think, 1 vote. But again, this is where the sort of islands of democracy that are down to the lowest level, where you live, people vote on those types of things. And people get to have the level of service that they vote for. So as far as the county commissioners, we have given them a number of things that we would like them to consider, and at this point, we've had no joy. So.
Well, I wanted to add to that, Mary, I think one of the things you might have alluded to was impact fees.
What?
Impact fees. The county has resisted impact fees forever.
Yeah.
Impact fees are those fees that the county or the city that has impact fees. I think the city of Ellensburg has a certain level of impact fees. What this does is it's an amount of money that a developer pays into the entity, the city, the county, wherever, to help them respond to infrastructure issues, which includes everything from water, sewer, police, fire, EMS, everything, as these which is that whole area, the whole piece, to help mitigate the impacts that these developments would have on these specific areas. So impact fees aren't something people love, but the question becomes, should the developers assist in the process as they are developing these things? Which, by the way, is also going to increase prices for the people who are buying property. Or are we going to continue to maintain where our general public is going to continue to support the infrastructure issues that we have? I mean, that's the question. And those are the questions that you need to be asking your elected officials who you vote for. Well, John's absolutely correct. I mean, being a county auditor for almost 18 years, running elections, oh my, those are some of the things that we work with constantly. You, as the public, as many of us have said, get to decide who your elected officials are. And those elected officials are the ones who get to decide the impacts, the level of service, and the level of process through your votes, both for them as well as for any tax rate that you choose. You're the one who gets to decide that level of service.
Sure.
I guess for this side of the table, I'm curious about your call volume for taxpayers versus non-taxpayers, I guess, in terms of the kind of breakdown percentage of calls. And then can you talk about the cost difference in terms of, did somebody who doesn't live in the district pay more than somebody who is?
I do not know the resident versus non-resident right off.
I've got it. It's about 35% of the calls are for non-residents. And then there's, for the medic one, there's a two-tiered rate. There's a resident rate, which is less, and then a non-resident rate that is higher. And then the mileage rate is the same for both.
Did everybody hear that? Did that answer your question?
Yes.
I just have a question. Or
Yeah, go ahead.
I think I can talk loud enough. Something I haven't heard here is, I believe it's fire-based EMS. I believe most of the people in this state are served by fire-based EMS for fire and medical services. I believe that's partly because that way taxpayers are paying for two separate entities providing service, and I think there's probably efficiencies and so forth in that. But I haven't heard that addressed. Did somebody address that issue? Are we moving towards that, or what's going on?
I can address it a little bit. Being a hospital district, we cannot join what is called an RFA, because legislatively we can't do that. And so that is an obstacle that would need to be, figured out on how to do that. KBFR does do that fire EMS stuff, and we can pass it down to John here.
Yes, so KBFR runs a fire-based EMS, and it is certainly possible for us to amalgamate the overall system. At this point, one of the things that I'll just share the story when I first came up here to be the fire chief with Fire District 7. I had an early meeting with Geoff, and we agreed that Upper County Medic 1, Hospital District 2, had the primary position of lead EMS agency in the Upper County. And his request to me was to stop trying to take us over. And I said, well, you can rest assured that we won't. It is, as a completely separate and apart taxing authority, junior taxing authority, Upper County Medic 1 is run under Hospital District 2. And there are provisions in how to amalgamate that. But that has to be a decision by the Hospital District 2 board. It cannot be done by a hostile takeover by KVFR or Fire District 7 or any kind of an RFA that is created by the Upper County Fire Departments, that has to be a decision that would come to the hospital district. Before I came up here, as the fire chief, we were working together between the two EMS agencies to discuss how that would look. And there is a path forward, but that's really up to the community. And so what my job has been for the last 4 years is to reiterate the primacy of Hospital District 2 as the lead EMS agency in Upper County. And if at any point in time in the future where the community wants to do that, there's a path forward, but it really needs to come from the community and from the Hospital District 2 commissioners.
Mary had another question.
Just to kind of add to that a little bit, you talk about efficiency with fire and EMS combined, and I think that it's definitely worth looking at. When we kind of look at the statistics and talk to the fire chiefs, EMS is accounting for approximately 70% of all fire and EMS related calls in Upper County. Working structure fires or working fires is probably 10% or less. For all intents and purposes, I'm still working in the field. This doesn't sound great, but everything can be on fire around us, and we're still going to respond to your heart attack because that's what our job is. So it keeps ALS available to provide that service. That would be a pro the way we're currently doing it now. There are pros for combining those two as well. So I guess there's pros and cons to both systems. But as it currently stands, we're here for your medical emergencies, period.
So, I just have a quick comment. The 35% figure of outside calls, of people outside Kittitas County calling in for emergency services, I really question, because when I served on KitCom, I believe that number is higher. To 911 anyway, our 911 service is being overrun.
It was 35% outside of the hospital district too. Some of it's for Ellensburg, and but it's 35% of non-hospital district too.
And those are transports.
Transports.
Those are not calls that we go to get a refusal or help somebody a little bit. So we can double that.
So the piece that's missing in this entire discussion is the part about our 911 service, which is about to starve to death. And if we don't get busy, we are going to get absorbed by King County or somebody else. And I'll tell you, this is one child that does not want that. They have no idea where I live. I could just as well call China.
So can you speak to the impact that mental health calls have had on your service? Like, is that a certain percentage of your call out is mental health and the lack of mental health services in Upper County?
I could probably speak to that for Upper County, and I bet it mirrors at KVFR. We've seen an increase in mental health calls, probably almost doubling every year since about 2019. I don't know the number, the percentage right off the hand, but it's definitely an impact. It ties people up, ties us up on scene to try to figure out where we can go with this person if they transport. Washington legislature passed a sort of restrictive law enforcement. It was no longer to be involved in that at all. And so that let us responders, we've got a great working relationship with all law enforcement, Upper and Lower County. And so they would continue to help us on that. But it's definitely one of those things that you're looking at. It's a free service that we're providing.
In regard to the mitigation costs that might be paid by developers of these huge things, the governments, when somebody comes in and says, we want to build this beautiful residential development, oh, look at all the tax money we're going to get, yay! There have been studies all over the United States, and residential developments never even come close to providing enough tax money to cover the costs of all of the infrastructure, the roads, the sewer, the water, the police, the fire, the medical. Right now, you call the Cle Elum medical office to get an appointment, and I called yesterday. My appointment is April 4th, and that was her first opening. And we need more of all of it. And as I recall, I don't remember the exact number of what the 47 Degrees North company, oh, we will pay you however many $1 million mitigation for all this is going to cost you, your governments, to do stuff. It was a drop in the bucket. Not even close to what it's actually going to cost. How are they going to get the sewer system big enough? How are we going to get the water? They want to buy water from Cle Elum, and they want to pay Cle Elum to handle their sewer. It can't happen. It can't happen.
Jerry, could you just, on a sub-question to that, what is the process for the county commissioners to change that and start applying a mitigation fee to these developers? Is it like a week-long process? Is it years?
Could you just repeat that question summary?
The question is,
Thanks.
if county commissioners were going to implement impact fees, how long would it take for that process to occur? Well, it would take longer than a week. And it would depend upon a lot on how they would wish to move forward. Because you would first need to advertise for a public hearing, you need to hold a public hearing, and then, depending upon the outcome, identify what they may be and adopt the resolutions or ordinances to do so, and then identify when those would actually start to take effect. So, my estimate would probably be, I'm going to say probably a minimum of 6 months. Or
If they decided
to move down that road, first of all, they have to decide to move down that road. So it could take, I would be surprised if it would take less than 6 months. It could possibly take longer, depending upon the issues and the concerns and the public input and how all that would work.
And the political will.
Absolutely.